Welcome to MedDecode.
MedDecode. MedDecode.
So today we're doing a really critical deep dive. It's, honestly, it feels like a national health audit.
Yeah.
If you're a parent or maybe an educator or really just anyone paying attention to, well, the future, you need to hear this.
Mm-hmm.
We're looking at this alarming, documented decline in children's health right here in the U.S. It's a crisis. We're talking mortality rates, soaring chronic disease, a deep mental health epidemic.
And this isn't just like feelings or anecdotes. The scale of the problem, it's right there in authoritative reports. They show a fundamental, a systemic decline.
Wow.
And in response, the U.S. government pulled together this thing called the Make Our Children Healthy Again, or MAHA Commission. It's meant to be this huge, comprehensive national strategy, right? Designed to stop and hopefully reverse these awful trends.
Right, and that's our mission today. We're not just skimming headlines. We're digging into the data that actually proves this decline.
Yeah.
We'll dissect the four root drivers the MAHA Commission is blaming for the crisis. And maybe most importantly, we're going to analyze whether this massive federal plan is the answer, or if, maybe, the fine print shows it kind of misses the biggest threats.
Well, it's a classic high-stakes situation, isn't it? You know, saying there's a crisis is one thing.
Yeah.
But actually putting together a credible, workable solution, one that can actually get past all the political pushback, that's a whole different ballgame.
Okay, let's get into it then. We really have to start with the data, the stuff that forces this whole conversation.
Right.
This is JAMA report, Forrest. They tracked trends from, 2007 to 2023.
Yeah.
And their conclusion was just devastating.
Yeah.
U.S. child health has fundamentally worsened across almost every measure, especially when you compare us to, our peers.
And that comparison, that's what really bumps this up from just bad news to, like, a national emergency. We're looking at the OECD 18, that's 18 comparable high-income nations. U.S. infants and children, so under 20, they are 1.78 to 1.80 times more likely to die than kids in those other countries.
Wait, hang on. Just to put that in perspective, we're not comparing the U.S. to developing nations here. We're talking about countries like Japan, Germany, Australia, our economic equals.
Exactly. Those ones.
And we're seeing a nearly 80% higher mortality rate for our kids.
That's correct. It's pretty stark. And the gap actually gets wider when you look at specific age groups, especially older kids.
Yeah, I saw that. When you look at the 1 to 19 age group, the difference is, it feels like a uniquely American problem, driven by trauma and violence, right?
Precisely. For that age group, the two overwhelming things driving that mortality gap, they're really specific to the U.S. experience. First, firearms. U.S. children are over 15 times more likely to die from a firearm than kids in those other OECD 18 countries.
15 times.
15. And second, motor vehicle crashes. U.S. kids are 2.45 times more likely to die in a crash. So, the sources are clear. While some health stuff is complicated, these death gaps, they're driven by very specific, often preventable societal things.
And beyond just, immediate death threats, we're dealing with what the sources call the sickest generation, this epidemic of chronic illness.
Yeah, that term really hits home.
The number of kids with chronic conditions is just climbing. It went from about 25% to 31% in just 12 years. That's like almost a third of our kids facing lifelong health issues. Imagine the impact on the future workforce.
And the PED-SNET data, that's the stuff pulling clinical diagnoses together. It paints an even sharper picture. It shows how fast specific diseases are accelerating. We're seeing major conditions increase by rates of like 3 times or more in just a decade.
3 times. What are the most alarming trends there? What should we really be focusing on?
Well, the biggest spikes, they're really in mental health and metabolic disorders. Major depression, up 3.3 times.
Wow.
Anxiety, up 3.06 times. But the data also shows these huge lifestyle impacts. Sleep apnea is up 3.22 times.
Which is mostly linked to obesity, right?
Primarily, yeah. Driven by the obesity epidemic, which now hits 20% of kids. And we can't forget the kind of silent killer, loneliness, feelings of loneliness among teens.
Yeah.
Up 52%.
52%.
It's a systemic failure across physical, mental, and social health.
It sounds completely overwhelming. Okay, so now this is where it gets really interesting. You mentioned the MAHA Commission.
Right.
Recognizing this crisis, they tried to simplify the problem. They identified 4 main drivers, they say, are responsible for this spike in chronic illness. Let's start with the one that seems most tangible, food.
Okay, driver number 1, poor diet and the rise of ultra-processed foods, or UPFs.
Ah, yes, UPFs.
The commission found that nearly 70% of a kid's calories in the U.S. now come from these ultra-processed foods. And this isn't just about kids making bad choices. It's about a whole food environment that's basically designed for addiction.
Right. The problem isn't just the UPFs, like lack nutrients.
Mm-hmm.
It's that they're chemically engineered to hijack our appetite signals. Isn't that it?
That's exactly it. They override our natural feelings of fullness, our satiety mechanisms. There's that famous cell study they cite in the report.
Yeah.
It's key here.
What did it find?
Well, they gave participants an unlimited diet of UPFs, and those people ate about 500 more calories every day and gained weight compared to when they were on an unlimited, unprocessed diet.
500 calories more?
Yeah.
Just because of the type of food?
Yeah. And that difference, it wasn't about willpower. It was because UPFs are designed to be hyper-palatable. You know, the perfect hit of salt, sugar, fat. It just keeps your brain screaming, keep eating.
So these foods, they aren't just pushing out whole foods. They're actively driving overconsumption and leading to nutrient gaps. And the report also flags specific additives, doesn't it?
It does, yeah. The MAHA report specifically calls out harmful food additives that are kind of hitching a ride with the empty calories.
Like what?
Things like Red 40, which has been linked to hyperactivity in some kids. And titanium dioxide, you find that in lots of candies, that's linked to cellular damage, which actually leads us right into driver 2.
Okay, driver 2. The cumulative load of environmental chemicals. How does that connect?
Well, if driver 1 is about what we sort of choose to eat, driver 2 is about what we often can't avoid. The main finding is that kids are just uniquely vulnerable because they're developing so rapidly.
Right, from in the womb, infancy, early childhood.
Exactly. And the placenta. It's often not the perfect barrier we maybe once thought it was. Chemicals can get through.
So what specific exposures are getting worse? What should people know about?
The sources mention the growing load of PFAS, the forever chemicals, and microplastics, which seem to be everywhere now.
Everywhere.
The report cited this really sobering 2025 study. It showed a 50% increase in the concentration of microplastics found in Americans' brain tissue.
In brain tissue, wow.
Yeah. And then there's the controversial issue of fluoride. They cite a systematic review in JAMA Pediatrics linking exposure above recommended levels to potentially reduced IQ levels in children. It's really about the sheer volume of synthetic stuff kids are encountering, and frankly, we need way better data on the cumulative long-term impact.
Okay, switching gears pretty drastically now to driver 3. Digital age behavior. This one probably hits home for almost every family listening. We're talking sedentary lifestyle, screen addiction, chronic stress.
Yeah, the lifestyle data here is just undeniable. Teens are averaging nearly 9 hours of non-school screen time every single day.
9 hours. That's more than a work day.
It's a massive chunk of their waking lives spent sitting still, basically. And as a result, over 70% of kids, and it jumps to a staggering 85% for teens, they fail to meet the basic recommendation of 60 minutes of daily physical activity.
Still little movement.
That lack of movement, plus the kind of chronic low-grade stress from being constantly connected or maybe disconnected socially, It's just fueling both the metabolic and the mental health crises we talked about earlier.
Okay. And that brings us to the 4th driver. And this one, this immediately pushes us into some pretty contentious territory. Over-medicalization. The commission really stepped onto a political third rail here, didn't they?
They certainly did.
What exactly is the report concerned about here?
Well, the concern, according to the MAHA Commission's report, is this perceived trend of over-prescribing medications to children. They argue it's sometimes driven more by, let's say, systemic incentives than strict medical necessity.
Okay.
They point to data like the 250% increase in stimulant prescriptions for ADHD between 2006 and 2016. But crucially, the MAHA report also raised concerns about the growth of the childhood vaccine schedule and specifically mentioned focusing on vaccine injuries.
And that specific part, the focus on vaccines, like you said, that immediately set off alarm bells and sparked intense controversy.
Oh, absolutely. Instantly.
How did the public health experts, the mainstream folks, react to seeing vaccine concerns included in an official federal strategy like this?
They were highly critical. I mean, they pointed out that we have decades of research establishing the safety and effectiveness of the current vaccine schedule.
Right.
And they argued that bringing vaccine concerns, which is, let's be honest, a highly politicized topic, into an official health strategy, it just distracts from the major agreed-upon health threats, things like diet, inactivity, mental health, and those mortality drivers like firearms and car crashes. The report's position on vaccines is really what drove a wedge between the political strategy and many public health experts.
Okay, that really sets the stage for the big analysis then. The MAHA Commission identified the problem. They gave us these 4 drivers. But now we need to pivot to part 3, the expert skepticism.
Yeah, the pushback.
We've seen some really fierce critiques from public health heavyweights, people like Lurie, Gostin, Marion Nessel. Why are they calling this big, comprehensive national plan weak and unproven? What's their main beef?
Well, the core issue boils down to selectivity, really. It looks like the strategy was shaped more by political limitations than by purely evidence-based priorities. And that leads to 2 huge flaws, according to the critics. First, ignoring major known risks, and second, these glaring policy contradictions.
Okay, let's start with the omissions. What critical known risks did the MAHA plan just completely sidestep?
The list is kind of stunning when you think about it. The plan avoids any mention of policies aimed at cutting tobacco use among youth, or controlling sodium levels in packaged foods, which we know is a huge issue, or regulating alcohol access for young people. But the most glaring omission,
Let me guess.
the entire strategy for making our children healthy again, completely avoids any policy measures related to the single biggest cause of death for U.S. children aged 1 to 19.
Firearms.
Firearms. It's just not addressed in terms of policy solutions.
That seems like more than just an omission. It almost suggests a fundamental flaw in what the report was allowed to look at. If the stated goal is child health, and you ignore the #1 killer in that age group, how can the plan be taken seriously by public health folks?
Well, that's exactly what the critics argue. They say it reveals the plan's scope was basically limited to the politically safer areas, UPFs, chemicals, screen time.
Stuff fewer lobbyists will fight tooth and nail over.
Potentially, yeah. While sidestepping the areas where corporate or political resistance is really intense, like gun safety regulations or mandatory food industry rules.
And then on top of those omissions, you have these internal policy contradictions. It's like they want better health outcomes, but they're simultaneously gutting the very things needed to achieve them.
Absolutely. It's a classic example of, talking out of both sides of your mouth. The MAHA plan proposes 23 new research initiatives on complex stuff like autism, EMR exposure.
Okay, research sounds good.
Right, but at the same time, the administration that commissioned the report proposed a massive 40% budget cut to the National Institutes of Health, the NIH.
Which funds nearly all that research.
Exactly. The NIH is the federal engine that powers almost all of that required scientific investigation. So you want more research, but you're slashing the research budget.
Makes no sense. And they do the same thing with nutrition access, don't they? They talk about whole foods, but cut the programs that help people buy them.
Precisely. They talk a big game about improving nutrition, reversing the UPF trend, but simultaneously propose major cuts to programs like SNAP food stamps and Medicaid,
which help the most vulnerable families.
The very families who are disproportionately slammed by the chronic disease crisis the report supposedly wants to fix. You can't credibly claim to prioritize nutrition while actively defunding the main ways that put food on the table and provide health care for the people who need it most.
So the overall strategy seems to avoid tough new regulations and relies instead on, what do the sources call it, voluntarism and personal responsibility.
That's the phrase, yeah. Instead of evidence-based policies that have worked elsewhere, like mandatory salt reduction in foods or taxes on sugary drinks, things shown to work at scale.
Right.
The strategy mostly relies on corporations voluntarily choosing to make healthier products and families just, choosing better options.
And how well does that usually work?
Well, public health history pretty clearly shows that relying on corporate goodwill and individual willpower alone, it's usually a strategy doomed to fail, especially when you're up against powerful, profit-driven industries like the massive ultra-processed food sector.
Okay, but let's try to end on a slightly more positive note.
Oh.
Was there any strong regulatory step in the plan that even the critics could get behind?
Yes, actually. To be fair, the MAHA plan does strongly advocate for boosting the regulation of food additives, specifically closing the loophole known as Generally Recognized as Safe, or GRAS.
Ah, the GRAS loophole. What does that mean?
Right now, that loophole basically lets manufacturers kind of grade their own homework when it comes to saying their additives are safe, often without rigorous, independent scientific review.
Usually.
Yeah. So, closing that loophole, That's a major common sense step that pretty much all nutrition experts support. It would bring much needed oversight.
Okay, so summing this all up, what does it mean for us, for you listening? We've got this undeniable, profound crisis hitting our kids' health.
Yeah, the data is staggering.
And we have a diagnosis from MAHA blaming modern life, UPFs, chemicals, screens, maybe even over-medicalization. But then the proposed solution seems, well, undermined by conflicting budget priorities and a real reluctance to tackle the biggest threats with strong regulation.
I think that's a fair summary. The overall takeaway is the crisis is absolutely real, but the proposed strategy seems like a politically constrained effort. It hits the soft targets, maybe, but it avoids the heavy lifting needed to really move the needle on outcomes, especially when you look at preventable injuries and ensuring basic access to food and healthcare.
So, for you listening right now, while this whole political debate inevitably grinds on, what's the practical takeaway? Based on the solid science that is cited in the MAHA report, what can families actually do right now?
Yeah, that's the key question, isn't it? Focus on the cornerstones, the things that are non-negotiable and mostly within a family's control.
Like what?
Prioritize a whole foods diet. That just means cooking more with actual ingredients, stuff that hasn't been massively processed, cutting back dependence on those UPFs.
Okay. More home cooking, less packaged stuff.
Exactly. Encourage active play. Really push to hit that 60 minutes of activity a day. Make sure kids are getting enough good quality sleep. Sleep hygiene matters. And keep those lines of communication wide open with your pediatrician. Talk about behavior changes, health concerns, anything. These are the immediate levers families really need to pull.
That is essential advice, absolutely.
Yeah.
Now, just to leave our listeners with one final thought to chew on. The sources we looked at, they repeatedly mentioned that American agriculture is incredibly abundant, super innovative. But historically, that innovation has focused on things like yield, shelf life, making things cheap to process.
Right, not necessarily focused on maximizing the actual health density of the food, which, paved the way for the UPF takeover.
And the MAHA report itself kind of acknowledges this tension, right? It mentions needing to work with farmers to make sure food is the healthiest, most abundant, and most affordable option.
It does touch on that, yeah. The potential is there.
So here's the provocative thought. If the U.S. really wants to reverse this chronic disease crisis and that shocking 1.8 times higher mortality gap for our kids, can American science and industry actually pivot? Can that incredible ingenuity be successfully redirected to produce food that is both super abundant and unequivocally health promoting?
Shifting the focus entirely.
Yeah. Can we finally shift the whole focus of food innovation away from just managing sickness after the fact and towards actually ensuring wellness from the start? That, I think, is the real challenge for the next generation of American public policy and for American ingenuity itself.
And that's a wrap on this episode of MedDecode. I really appreciate you joining me today. If something we talked about sparked your interest, or if there's a medical term that's been bugging you, let me know in the comments. And if you enjoyed this, be a pal and share it with a friend. We'll catch you on the next one.